Hello, good evening. Welcome to Ubuntu channel. Today is Monday, the 5th of September, and we are here to present you Ubuntu Health Zone. And to help me discuss everything that is pertaining to our topic tonight, I'm joined by Dr. Maseka. Dr. Maseka, good evening and welcome to Ubuntu Health Zone once again.
Good evening, Reuben. Thank you so very much. Good evening, viewers. I'm
Thank
Dr.
you.
Maseka again, back on this program again. Thank you.
Always happy to see you, Doc. I know your job is so involving and just giving us time to have this program. We appreciate so much.
I'm grateful, Reuben. Thank you. You're doing an amazing job, by the way. You're doing an
Oh,
amazing job. Thank you so very much.
thank you very much.
Yeah.
Our viewers, tonight we'll be talking about cervical cancer. So don't be selfish. Share this broadcast so that the information can go to as many people as possible. Tag them here. Tell them that Dr. Maseka is here. The doc all the way coming from UTH, Women and Newborn. Doc, just briefly, just tell us what happens there at your hospital.
What happens when a person comes? What do you mean?
Uh, no, as in the function of your department there at the hospital, the women's and newborn.
Oh, okay, okay. I'm actually an obstetrician gynecologist. I'm based at the Women and Newborn Hospital. So really, what we Women and Newborn Hospital, like the name tells, deals with women and newborns. So our clientele usually is the female and the babies in their early. When a baby is just born, we are the first ones that see that baby and handle the baby before the pediatricians get on board. We see the baby first. Um, Besides that, I think the only time we get to interact with the men are when they're escorting their wives, especially for the infertility clinics or antenatal. And of course, yeah, when they decide to escort their partner. But often we deal with the female, like the name tells, Women and Newborn Hospital.
Thank you very much to our viewers. You can participate on this live broadcast by typing in your questions in the comment box, and we'll also share the link with you so that you may come in and ask Doc the question. Today, Doc, we're talking about cervical cancer. And the first question before we go to cervical cancer, I wanted to understand what is cancer.
All right. So a cancer is any disease. I'll put it in a simple term for all of us to understand. But basically,
Yeah.
when one has a cancer, what that means is that there are some cells that are growing uncontrollably. And these abnormal cells, I'll call them abnormal cells. So there are some cells that are growing uncontrollably, and these are abnormal cells. And these cells can also go to other parts of the body. They will not just stick to that organ that they've affected. No, they can also go to other parts of the body. So that's basically what a cancer is. Cancer is a disease in which some body cells grow uncontrollably and they have ability to spread to other body parts. So in a nutshell, that's what a cancer is.
All right.
So when we're saying
So are
cervical
those?
cancer,
Yep. Go ahead, Doc.
yeah. So when we're saying bone cancer, for example, it means that bone cells, the cells of the bone, are the ones that are growing abnormally. So when we say cervical cancer, it means that the cells of the cervix are the ones that are growing uncontrollably, abnormally, actually, uncontrollably, and they have ability to go to other body organs, especially when the cancer, that's what we refer to as metastasis, where the cancer cells can go to the lungs from the cervix, they can go to the lungs, they can go to really to any other part of the body. Yeah, so cancer cells are abnormal cells that are growing uncontrollably and they have ability to go to affect other organs as well.
Oh, okay. Make us understand, Doc. You said cancer. This a growth on a body part. So now today we're talking about cervical cancer. Let's now bring it on. What is it that we're talking about here when you say cervical cancer?
All right. So, cervical cancer, that's cervical cancer, that's cancer that affects the cervix. So, I wish I wish I could draw somewhere. All right. So, okay, the female genital organs. I wish I could really draw somewhere, to depict my. Okay,
What
let
is
me
it
see
that
if
you
I can
want?
find.
I might tell my director just to help us with that.
Okay, so what I want is a director able to sort of like depict a picture of the uterus. So I'm looking at the ovaries, the ovaries, all the way the fallopian tubes, and then we have the uterus and we have the cervix, then the vagina. So I'm interested in the cervix. I want to show people which one is a cervix, so that even as we're talking about cervical cancer, they can explain which part of their reproductive system gets affected. Are we able to
Okay.
have maybe a
So
picture of that?
I'm
Or
sure
I
the
can.
director will be doing that in the background, but you can just go ahead with your explanation. Then
Exactly.
he's going to
So
beam that. Yeah.
when we say cervical cancer or cervical cancer, what we're saying basically is that the part of the reproductive system, like the part of actually the cervix is part of the uterus. It's part of the womb. This is part of the womb that is sort of like that you find in the vagina. So if you're doing a vagina examination, you'll feel the cervix as you're doing your vaginal examination. So it's part of the uterus that is that you can feel vaginally. So this is a part that gets affected. The cervix is a part that gets affected in cervical cancer. And like I mentioned, so what will happen? Ideally, the body has a way by which new cells are formed. Some cells undergo, die off, and it's like it's in equilibrium. You know what I mean? The growth of the cells are sort of like controlled. They are controlled. Otherwise, you find that maybe your lips grow and they don't stop growing. So there's a way that your body certain body parts are supposed to be put in control. Your cells are in control, but sometimes you find that the process of cell growth and cell death, you find when there's a cancer, it means that the process of cell death is affected. These cells are just continually growing abnormally, uncontrollably, and they keep growing like that, uncontrollable, causing a cancer. So in this case, that abnormal growth is happening at the level of the cervix. It's a cervix that's affected. So we call it cervical cancer because it's a cervix that is affected.
So, doc, for me, I'm safe. Is that right for this?
Well, not quite. It's you're either affected, they
When,
say you're either infected or affected, isn't it?
yep.
So as long as you have a female that they can have it. And actually, by the way, human papilloma virus is a culprit that has been noted to be responsible for causing cervical cancer. So this virus is can be transmitted sexually. So it means that you can have a male partner having this virus. They don't even know it. And then they meet with a partner and then they infect that partner with that virus, human papilloma virus. Then later on, you find their partner having cervical cancer. But really, cervical cancer is something that everyone should get concerned and get on board in fighting this because it's not just a female. It's as a result of a viral infection which is sexually transmitted. Yeah.
All right. Thank you very much, doc. You've talked about the human papilloma virus, the HPV, as one of the causes. Are there any other causes that leads to cervical cancer?
So the culprit of cervical cancer really is human papilloma virus, but we must understand that human papilloma virus itself has there are different strains. You know, it's like have you anyway, growing up, I do remember seeing some people having like a hard growth on the hand and whatnot, the one that they would even cut sometimes, and people would cut it. or they can have like a growth on there and that is actually that is a what.
Oh,
Okay,
okay.
so
Mhm.
human papilloma virus is the one also that's responsible for causing warts as well. So the what can be, I've seen people having warts on their hands, on the face, on the neck, and of course, we see these warts, people having them in the genital region, in the genitalia. They have warts, whether male or female. So the same organism, which is the human papilloma virus that causes these warts, is also responsible for causing cervical cancer or penile cancer, you know. So otherwise, HPV has different strains. They're different in short. I don't know if I can say human papilloma virus has different types. So there are some types that can predispose to having, say, genital warts, and those types cannot make someone to have cancer. Yet at the same time, there are some types that can cause someone to have cervical cancer. And of course, sometimes you find that these strains can actually, you find the strain that causes cervical cancer is also is like is together with that strain that causes warts. So sometimes you do get patients that have warts, but those warts they have is because of HPV type that is also not only responsible for causing warts, but also can cause cervical cancer.
All
I
right.
don't know if I'm clear on that.
Yes, you are. Doc, now we have the peak of this of the cervix.
Thank you. So I think you can clearly see what looks like there's a little dot there and like a bore, that's a cervix. And on the lateral aspect, on the sides, those are the vaginal walls. So from the vagina, if you go straight, what you hit is the cervix. And you can see the opening of the cervix. So in cervical cancer, what gets affected is the cervix, like the one we're seeing there. That's the one that gets affected, exactly. But like I explained that these cancers, the abnormal cells will start with the cervix, but they have ability to go to other body organs as well. Thank you for that, for the images. Thanks.
All right. Thank you very much. Now, Doc, we've talked about all those causes. I wanted to understand now who is at risk of having this cervical cancer. Is there any age group where you can say these are more at risk of getting cervical cancer?
So really, yes, there are some risk factors to cervical cancer. So anything that can predispose you to acquiring the virus. For example, having multiple partners. Having multiple partners is a risk factor because you know that as you're having these multiple partners, one of them can carry the virus, and you'll find yourself having it. So mostly the risks are around sexual habits. In short, sexual habits really. I think that's how I can summarize it. Since we know that the virus is transmitted sexually, therefore, anything around sex that can affect the sexual habits, risk could even be, for example, if you think about it, like people that abuse drugs. When people abuse drugs, the issues of judgment are impaired. So you find they would resort more to risk behavior, and they would resort more to having unprotected sex, or would resort more to having sometimes even just someone's behavior, having multiple partners. All those things predispose to having to risking for the men. You risk your partner to having cervical cancer because of the HPV virus. But also, like in people that are not circumcised, men that are not circumcised, it's been noted actually that it's a risk somehow because of the foreskin tends to harbor that, uh, you know, tends to harbor the
The
virus
HPV?
itself. Exactly. The foreskin tends to harbor the virus. So circumcision in a way is actually a protective something protective that people can actually do. Yeah. So the risks are plenty, but it's around sexual habits really. So for
All right.
example, Reuben, you
Mhm.
can find this man who was playful, having multiple partners, he could have contracted it and maybe somehow they don't have warts. Because just because you have HPV doesn't mean that you should have warts, isn't it? We've said that there's different strains. So someone can have a strain that does not cause warts, Or they can have a strain that causes warts, but their immunity is strong enough that they don't have warts themselves. Then they sleep with this girl. Maybe let's assume she's a virgin. She's never slept with anyone else. It's the first time she's sleeping with somebody. And so this person, then this young lady goes on to develop warts. Meanwhile, the person who infected her has no warts. It's because warts play around immunity. So you find this one could have had the strain that causes, say, warts. They sleep with this girl, and this girl has the warts, while the partner does not have warts. That's how HPV can behave. At the same time, this guy could have played around, sleeps with a partner. The partner, instead, they may have warts, and later on, maybe even have cervical cancer, because they could have gotten strains that cause warts and also strains that cause cervical cancer. Or sometimes they may not even have warts. Everything, if you look at them, they will look normal, yet they are having strains that cause cervical cancer. Then later on, they develop the cervical cancer. And of course, HIV as well is something that, because of how how HIV affects the immune system, most of these viruses thrive when the immunity is gone down, just like flu. Most people tend to have flu when they're stressed and whatnot, because immunity really goes down, then you have your flu. So same way, with reduced immunity from HIV, you find that the risk of it's like that amplifies even this cervical cancer. But of course, with the treatment that is there, that is not expected. As long as someone has their immunity is good, their viral load is good, then yeah.
Thank you very much to our viewers. If you are joining us, you're watching Ubuntu channel Health Zone, and I'm joined by Dr. Maseka, and we are discussing about cervical cancer. If you have any question, you can type your questions in the comment box, then we're able to read your questions, and Dr. Maseka is going to answer them. Doc, really, from your explanation, really this needs a lot of awareness, because most of the times when people are having sex, the only thing that comes into your mind it's about HIV. Though I might contract HIV, but from your explanation, saying that someone can even get HPV, an HPV virus, which can cause
Mhm.
cervical cancer. Am I right?
Exactly, exactly. Actually, I like to say that sex appears innocent, perhaps few minute pleasure or something like that, but it actually has a price tag that you don't see. It has a price on it that you don't see. That's why sex should not be taken casually, because it has a price tag. The price could just be, for example, HIV. You sleep with someone and you end up contracting. It could just be other STIs. It could just be the same HPV, which is an STI, or it could just be, it could be anything, because sex has a price tag. So people have to be careful regarding sex, you know. And unfortunately, you find that most young people have these risky lifestyles when they're young, and then when they grow up, they start really battling with the consequences of their lifestyle when they're grown. Yeah.
Thank you very much. Now, Doc, still talking on the causes. We've heard a lot about women using sunko and all that. Can this sunko cause cervical cancer?
Well, I can't really say causing. What causes is the human papilloma virus, isn't it?
Yeah,
Exactly, we are clear on that one, right? So
yeah.
infection with that human papilloma virus, and depending on the strain, is what causes. But there are some risky behaviors that can predispose someone to contracting the human papilloma virus. For example, if you're for men, like circumcision sort of like makes the prepuce sort of like able to withstand trauma. Okay, in an event where people are having sex, you find because they're circumcised, it sort of like builds another layer of epithelium which is stronger. So you find that the person who's circumcised will not sort of like have bruises easily compared to one who's not circumcised. Are you seeing? So if someone is having sex with a lady that has HPV, one is circumcised, one is not circumcised. The one who's circumcised, the chances of him getting bruised is quite slim. The one who's not circumcised, the chances of them getting bruised is a little higher. So you find the one who's not circumcised may end up contracting the virus. So I think these people, that vaginal douching itself, whether you're putting sunku or you're putting whatever they put, is not vaginal dodging is not good. It actually has more risks than benefits. Yeah, because you can be doing those dodging and then you're hurting yourself or you're disturbing the normal flora of the vagina, and in the end you find that you having like getting intimate with someone will actually result in you contracting things, because already you've made your the vaginal walls like fragile because of pushing in things. So the vagina dodging is not good and it shouldn't be encouraged, whether it's in sunku or it's anything. The vagina cleans itself and it must be left alone.
All right. Thank you very much. Our viewers, you can type in your questions in the comment section. Then we'll read the questions, and Doc is going to answer all the questions. Doc, now, if someone has cervical cancer, they have not yet tested,
Yeah.
how can they know what are some of the symptoms they can look out?
So the most important thing, like now, I know, Reuben, that you're aware that the government has been trying to prevent cervical cancer. That is to say, primary prevention of cervical cancer by ensuring that they conduct these vaccinations. I think you could have heard about vaccinations, HPV vaccinations. They were targeting, I should think, 9-year-olds to 14-year-olds, thereabout. They're targeting, in short, they were targeting these people that have not yet had sex. You're thinking they've not yet engaged in sexual activities, therefore we can vaccinate them. Because if someone has engaged in sexual activities, the chances of them having contracted this virus is quite high. So the primary prevention of it is actually by vaccination, which the government has been freely giving to these children in the different schools. They vaccinate our girls. Um, but vaccination can also be done for the boys as well, because they also get this virus. So the time when patients come to seek help, often it's late when they come to seek help. The reason is like any other cancer, the time you start having the symptoms, it means that the cancer is already advanced. So to prevent that from happening, I'll talk about the symptoms first. Like the symptoms, for example, that women typically come with is increased per-vaginal discharge. Like they'll tell you that every time when they're intimate with someone, they bleed after the act. After being intimate with someone, there's what you call postcoital bleeding. They may have intermenstrual bleeding. They may have foul smelling per vaginal discharge. It's quite foul smelling. Typically, these are the symptoms, and of course, the anemia because of the bleeding that is coming, that is setting in. But by the time these symptoms are coming, like contact bleeding, for there to be contact bleeding, it means that the cancer is already there and it has it has moved, of course, not to really a bigger stage, but of course it's advanced you know so what is best is for us to do a lot of public awareness, encourage our women, any girl out there who's sexually active, let them go for cervical screening. Why are we saying let them go for cervical screening? The reason is, when you go for cervical screening, they'll be able to find the pre-malignant lesions. I said that cancer is abnormal growth of cells, isn't it? But these
Yes,
cells
yes.
do not just grow like boom, they are there, and before you know it, there's a lump growing on your cervix. No, they go in stages. So you find when you're going for your cervical screening, as long as you know you are sexually active, go to any government facility, because these services are for free. They are very much for free in almost all government institutions, Lusaka, anywhere. I think the fight against cervical cancer has been massive, and most of the places in Zambia can have, at least someone can have screening there. Go to Mansa, you can have your screening there. You can have your cervical screening. Why are we advocating for cervical screening? Is because we can pick the pre-malignant lesions. Because remember, before you have cancer, there's what we call CIN1. I won't go in details, but there's what we call CIN1 is pre-malignant, meaning before the cancer sets in. There will be abnormal cells that will start, as the abnormal cells are starting, they'll be picked. Now, these abnormal cells, they have levels. I'll call the first level, we can say CIN1. Then after CIN1, you have, and CIN1, it can resolve on its own as your immunity boosts, sort of like builds up and whatever, it resolves on its own. You go for a cervical screening again, you find that you are normal. Then there's a next level, which is also pre-malignant, meaning before the cancer, called CIN2. CIN2 is a little advanced than CIN1. more cells are involved, more layers of the cervix are also involved. So with CIN2, we treat it. Now it's when a woman goes for screening, we do what we call VIA. That's where we screen a woman. When we see abnormal lesions, if they meet the criteria, you treat her by doing a lip. A lip is performed, and that the part of the cervix that is cut out is sent for histopathology, and it will come and tell us what is there really. Otherwise, cervical cancer stages. You can have your CIN1, then CIN2, CIN3, then you go to cancer in situ, carcinoma, cancer starts. And as well, cancer also has stages 1 to 4. You see, so it has also the cancer stages. Also, before cancer, what we call the pre-malignant stage also has 3 stages. So our desire is that if our women go for cervical screening early, we are able to pick the abnormal cells, and we're able treatment is there. When we get the abnormal cells, the pre-malignant cells, a woman is given treatment there and then. There and then they are given treatment, and this treatment is very effective, actually, very, very effective. Uh, Only those who don't like going for screening are the ones we pick. You find they'll come later on when now they're having these symptoms. But remember, by the time someone is having symptoms, niche, the cancer is already there. By the time a woman is having say pervaginal discharge, the cancer is already set in. By the time the woman is having contact bleeding following sex, the cancer is already set in. The best time is to pick the cancer when it's still pre-malignant, before it becomes cancerous, when there's still these abnormal cells on the cervix. That's the best time to pick it. And this can only be picked by telling our women, any woman who's sexually active, ensure to go for your cervical screening. And the screening schedule, for example, you go for screening, you find that you are normal. If you're normal, they'll tell you when to go next for your next screening.
All right. Thanks, Doc. How common is this disease, Doc?
So, in
Here in
developing
Zambia.
countries, in Zambia as well, in developing countries, including Zambia, amongst gynecological cancers, the commonest killer is cervical cancer. So even in
Really, Doc?
Zambia, yes, exactly. In other countries, you get breast cancer. Developed countries, you find breast cancer is the one that tops up. But I think in most developing countries, including Zambia, cervical cancer is the commonest, and it tops in gynecological malignancies as being a killer. Of gynecological malignancies, it's the commonest killer. Yeah.
Thanks. One of our viewers, Doc, is saying, I have I have ab- I have abnormal bleeding. Uh, can this be a sign of cervical cancer?
Thank you for that question. Well, abnormal bleeding is not necessarily equal to cervical cancer. Abnormal bleeding could be anything. Abnormal bleeding could be because of a polyp. It could be because of a fibroid. It could just be what we call well, unknown. You don't know the cause, and someone is bleeding. So, to make the diagnosis of cervical cancer, normally we look at the history, the presentation, we assess the patient. You do your examination and, of course, investigation. All these things put together will tell you that, of course, you're dealing with cervical cancer. But for that person that has abnormal bleeding, the best is they go to the hospital, they get seen. And if this abnormal bleeding as well, you want to know, is this abnormal bleeding just because for cervical cancer, typically it's bleeding following sex. In short, we call it contact bleeding. If she puts her finger in the vagina, there will be contact bleeding because the cervix is no longer the same. So if someone has intimate relations, following that relation, they'll have a contact bleeding. But more so as well, they have foul smelling per vaginal discharge. So it's not just abnormal bleeding. Abnormal bleeding could be anything. So the best for her is to go to any health facility. The doctor will see her and attend to her and see what's going on.
So, someone with cervical cancer, is there any chance, Doc, that they can uh, conceive? Can they become pregnant?
Yes, 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 yes. I've seen patients that come in, they've got cervical cancer and they're pregnant. Yes, very possible, because cervical cancer can affect anyone regardless of age, as long as you're sexually active. I think the youngest from my experience I've seen with cervical cancer was a 27-year-old girl. So it can affect anybody as long as you're sexually active, really. So it can affect you. And also, depending on how your immunity is, that also determines how fast it kicks in. And of course, there are other factors, your lifestyle, especially around your sexual habit. So that also contributes. But yes, someone with cervical cancer, as long as they are ovulating and they're having sex, they can get pregnant.
Let's talk about the prevention part, Doc. Um,
Mhm.
Someone here has stated, I've checked, I don't have cervical cancer. Now, how can I prevent myself from contracting this?
So if you have been having sex, it means that the chances of you having the virus are quite high. So really, I can't talk about primary prevention. I can't talk about saying you get a vaccine and whatnot. No, anyone who's sexually active, they're past that stage of getting vaccine, because then you're assuming that they have been exposed. Unless in a setting where they're able to check for the virus and they find that they have not been infected, then that person can access a vaccine and of course protect themselves. But in someone who's sexually active, if it's a female, the best that they can do for themselves is to protect themselves, is to go for cervical screening, go for your checkup, follow the schedules that you've been given. That's the only way you can protect yourself, really, as well as being mindful of the sexual life. I mean, the sexual lifestyle. Multiple partners will predispose you to having cervical cancers. So, why does it predispose you? It's because through multiple partners, one of them can have HPV. So the
All right,
best
Doc.
prevention of this is ensuring those that can abstain until they get married, they do so. Those that can't, you ensure you use a condom, because a condom will protect you from having HPV. Those that can't, you use protection, use a condom. And if you can't even use a condom, you just want to have sex like that, ensure that you go for your cervical screening, so that as at least that way, when we're having the pre-malignant cells, they can be picked early and treatment can be given to you.
Let's also remove some myths, Doc,
Mhm.
about the diagnosis. A lot of people say, no, when you go there, when they're doing the diagnosis, it's painful. How true is that?
Pain is relative, Ruben. I can't really argue it. I can't argue, but I've had my screenings several times and it's not painful. So, what we do when screening a woman is we use what you call a speculum. The reason is, for me to be able to visualize the cervix, I need to use a certain instrument that will sort of like, when I push it inside, I'll be able to visualize the cervix. That's called a speculum. It's not painful. No, it's not painful. The speculum may be uncomfortable. Yeah, if you say uncomfortable, I'll agree with you, because sometimes it comes like a little metal. Sometimes it's plastic. So when it's a little metal and it's cold, that metal, of course, will be cold, you know. But it's painful. No, it's not painful. It can be uncomfortable because you're having someone put something in your vagina because they need to see the cervix. So that can be sort of like uncomfortable. Pain wise, no, it's not painful. And the procedure is actually quite fast. It doesn't take long. I think within 10 minutes, one should be done with the screening. And there are
If
two
this,
methods. You can, if you, yes.
go ahead, Doc.
Yes, so we can use, commonly we're using in most of the government hospitals, we're using two methods. That's a pap smear and the VIA.
All
Yeah,
right.
both are
So,
quick methods actually. Mhm.
okay. So if you do the screening, Doc, and my wife
Mhm.
turns out to be positive, she has the cancer. Uh, what really, as a partner, what support can I give my wife? Or what role can I play to a person that I'm a partner to this person uh, who has the cervical cancer? Really, what role can I play to help out in this place, in this situation?
All right, cancer. The problem with cancer is the mental aspect of it. If I told you, Ruben, that Ruben, I have cancer, the first what will cross your mind is, oh, death.
Yep.
Doc is dying. Cancer is equal to death. So you find that even a person that was doing fairly well, when you break the news that, oh, we think you have cancer, I've seen people go down. Mental health is something that we've neglected as a country. I think we've not done much in terms of mental health, but support is everything. Support is everything. So if someone has been diagnosed with cervical cancer, it's not a death sentence. There's help there, depending on the stage that one presents, there's help there. So having a support system that's strong, I think, is just amazing. People tend to do well because remember, the treatment itself, first of all, when someone has been given bad news like, oh, you've got cancer, what to go on in their mind is, look, I'm going to die. No one wants to die. Of course, we all know one day we're going to die because it's in the Bible, but really, I don't want to die. Nobody wants to die. So when someone is told, oh, you have cancer, what comes in? I'm going to die. And before you know it, they'll start worrying, and before you know it, they'll go into depression and whatnot. And if they're in this battle, like this phase of their life with someone holding their hand, someone there, they may not really know what is going on, they may not change anything, but just the mere fact that this person is there giving support, there to support. Because sometimes patients give up, like sometimes you just give up, you know what, my body is tired, better I die. Because cancers are quite painful. You find our patients are in pain and whatnot. It's not a good place to be in. But if you've got somebody who's a strong support system, I think it makes it easier. It makes the road better. Together, the medical personnel, the people at home, the partner supporting this person, it makes it easier for them than, where they are neglected. That is more traumatizing because even the drugs that are given, those are strong drugs. Those are strong drugs that are given. Sometimes they have to undergo surgery, and this is a long surgery, a major surgery. Sometimes like nobody wants to have anything going on wrong, to do anything to do with their private part going on wrong. Obviously, those are sensitive parts. So when someone has something like that, it's like when a man has penile cancer, it can result in depression. So the same way, you find someone can go in depression if they don't have a strong system around them. And family, I think, is one of the best strong support systems that one can be given as one goes through this phase of their life.
Any nutritional advice, Doc? Maybe if you
Anyone?
eat kapati magwava, nutritional advice. Maybe ukachagua tu magwava, or when you eat whatever, it can help out. And
Well, food is important. I think I will not comment much on that. I would rather have a nutritionist give comment on that one. But all I can say is that food is very important. After all, they say you are what you eat, isn't it? If you eat clean, you prevent some diseases from coming. So even as someone, remember, cancer is like cancer cells rip you off, they eat you off. So of course that plays a major role, because they eat you off and whatnot. So that plays an important role. But as to pinpoint saying this one is better when you're having cervical cancer, that one is difficult for me to say. I think the nutritionist can help in that. But just what I can just say is roughly a balanced diet, I think, is good. Eating clean, balanced diet is good. Just general, just the way it is good for you, Ruben, it can be good for somebody that's not well.
all right, thanks, Doc. We're just coming to an end. Time is not on our side. Doc, just summarize it for us now on cervical cancer.
All right, so cervical cancer is these are abnormal cells that grow uncontrollably on the cervix. And these abnormal cells can affect other body organs. For example, they can move from just being on the cells, they move to the lungs. So someone can have difficulty breathing. But when that reaches that stage, it means that it has reached an advanced stage, what we say metastasis, where cancer cells move from their origin, the place where they started from originally, to another place. Cervical cancer, yes, is preventable. It's very much preventable and treatable. Help is there. The best help is for our children that are not yet sexually active, or for those that are not yet sexually active. Vaccinations are there to prevent you from having, the HPV. For those that are sexually active, the best you can do for yourself is ensure that you go for a cervical screening and you follow the schedule that you've been given for the screening. And for our male folks, I think in the fight against cervical cancer, circumcision is something that one can consider as a protective mechanism, not just for yourself, but also for your partner. And of course, lastly, I would like to say that cancer is not a death sentence. There are many people that have fought this battle and have actually won the battle against cancer.
Thank you very much, Doc. Our viewers, there you have it. This has been Ubuntu Channel Health Zone. And I was the host, Reuben, and my guest was Dr. Maseka. We were talking about cervical cancer. See you again next week, same time on Monday, 20 hours, when we bring to you a new edition of Ubuntu Zone. For now, it's good night and God bless you. Have a lovely week.